Hi, Dr. Bruno here. I just want to introduce our weight loss program that's centered around compounded versions of Ozempic, which is semaglutide, and Mounjaro, which is tirzepatide. Now, these injections are done once a week, and we mail the medications to you. So this process is fairly simple. First, we do a consultation, either virtually or in person, to determine if you're a candidate. Then, if you are determined a candidate, we'll have you sign up online, and then we'll get some blood work done just to make sure that your hemoglobin A1C is okay, your thyroid and your electrolytes are intact. And then if that's okay, you'll choose the drug, semaglutide versus tirzepatide. Once that's done, we'll ship the medications directly to you. So you'll get them once a month, and then we'll follow you every couple of weeks, see how your progress is going, and the medication dose will incrementally increase each month. How long you're on the drugs depends on what your goals are and what your weight loss goals are and how much you're planning to lose. And then we'll also discuss how we'll taper you off these drugs so that you have a smooth transition off of them. So that's just a brief description on our program right now. So how do these weight loss medication drugs work, like semaglutide and tirzepatide? Well, they basically work on the central nervous system. They decrease your appetite, and they also work on the GI tract. They create the pancreas and cause the pancreas to increase its secretion of insulin, and everything goes towards decreasing your gastric emptying. So they basically slow down your stomach, and one of the side effects people will get is nausea and constipation from that. So the semaglutide acts on the GLP-1 agonist. This is the glucagon-like receptor. And tirzepatide acts on two receptors, the GLP-1 agonist as well as a GIP, gastric inhibitory peptide. So because tirzepatide acts on two receptors, it does have a faster weight loss associated with it. So that's how the drugs work, basically. And they're peptides. So these injections, don't think of them as hormones or pharmaceuticals necessarily. They're peptides, which are short collections of amino acid chains, and they have a very short half-life in the body. So if you stop taking them, they'll be out of the body in about maybe 5 to 6 days, depending on which one you're taking. So just to remind you, the GLP-1, this is a chemical that is made in our bodies naturally. It's made in our GI tract. So what these drugs are doing is mimicking what these molecules that our body makes naturally, but it's mimicking them such that it will decrease your appetite, cause you to eat less food, and therefore lose more weight. What are the side effects or the risks of taking these types of weight loss medications? Well, the most common side effect of these drugs is that they will decrease your appetite and therefore lead to nausea. They can also lead to other GI symptoms like bloating, constipation, even diarrhea. Now with tirzepatide, those side effects are noticeably decreased, but that's the most important side effect, is basically GI symptoms related to nausea. And as time goes on while you're on these medications, those side effects will start to diminish. As far as risks of the drugs, the number one risk is they talk about medullary thyroid cancer. This is a special type of thyroid cancer. It's only been identified in rodents so far, not in humans, but it is a warning that's on the drug. So if you have a history of thyroid cancer, or anyone in your family has a history of thyroid cancer, or any endocrine neoplasia syndrome, it's called MEN syndrome, then you would not be a candidate for this. Also, if you have a history of pancreatitis, you would not be felt to be a good candidate for this, because again, one of the mechanisms of action of the drug is it makes your pancreas secrete more insulin. So this can cause, or this can lead to inflammation of the pancreas known as pancreatitis. So that's sort of a contraindication to taking the medication. Another risk of the drug is gallstones or gallbladder disease. This has been seen in maybe 1% of patients taking the medications. And also alopecia or hair loss has been seen in less than 1%. Those are sort of the main risks and side effects associated with semaglutide or tirzepatide. So I just wanted you to be aware of those before you consider taking these medications. Who's a good candidate for these medications? Basically, anybody with a BMI over 30 BMI again stands for body mass index, which you can calculate online by entering your height and weight. Or if you have a BMI over 27 with a weight-related condition such as type 2 diabetes or high blood pressure. And again, during our virtual consultation or in-person consultation, we will review your medical history and determine if you're a good candidate for these types of drugs. How much weight can you expect to lose while on these medications? Well, most people will lose 5 to 10% of their body weight, with others losing 15 up to 20% of their body weight, again, depending on which drug you're on and for the duration. So for example, if you weigh 200 pounds and you're going to lose 15% of your body weight, that's about 30 pounds. It can take about 8 months, and you'll have faster results with tirzepatide compared to semaglutide. But essentially, most people, when I say most, I mean 2/3 of patients are going to lose about 10 to 15% of their body weight. So keep that in mind if you want to begin treatment using these medications. What is the cost of these medications? Well, the monthly cost for semaglutide is $500 per month. The monthly cost for tirzepatide is $650 per month. And again, the duration or how long you'd need to be on these drugs really depends on your individual circumstance and how much weight you plan to lose. I would say on average, most people are going to be on these drugs for as short as maybe 3 or 4 months, with the average being closer to 6 to 8 months, and some people might be on them a year or longer. The retail cost, so to speak, of the trade name Ozempic and Mounjaro is much closer to $1,200 to $1,500 per month. So again, the drugs that we're using are a compounded version from compounding pharmacies that are using the generic form of these medications. What type of lifestyle changes do you need to do in order to be on these medications? Well, we recommend patients to stay very well hydrated while taking these medications, because remember, it decreases your appetite. That's both for food and for liquids. So we don't want you to get dehydrated. So drinking plenty of fluids while you're on them, eating a high protein diet, doing resistance training, because a certain percentage of the weight loss could be muscle if you don't take preventive measures by increasing your protein intake and doing some sort of weight training or resistance training. Also, we recommend patients taking a supplement such as creatine. Again, we want to minimize the muscle loss while you're on these medications. So those are just a couple pointers while you're on these medications. Remember, these medications by themselves aren't the answer to weight loss. You must make lifestyle changes around your diet, your activity, exercise, improved sleep in order to have great success with these drugs. What happens when you stop taking these medications? Well, your first thought might be, are you going to gain the weight back? And in studies that they've done, which were studies done by the FDA to gain FDA approval, which were over 68 weeks and 72 weeks, patients who stopped the medication, they did gain about half of their weight back. But there are ways to minimize that and avoid that. Primarily is tapering off the dose. So in other words, instead of taking 4 injections a month, we reduce you down to 2 injections a month, or even 1 injection a month. But again, making those important lifestyle changes, changing your diet, increasing your activity level, eating a high protein diet, those will all go toward decreasing the amount of weight that you could potentially regain once you stop the medications. I hope this brief summary of the weight loss medications, semaglutide and tirzepatide, was helpful. If you still have any questions about these medications, their side effects, or if you're a good candidate for them, feel free to reach out to our office or contact us through the website directly. We're here for you, and if you have any questions, just let us know. Thank you.